Thursday. I can't believe we're already hitting the end of the week. Let's see, we already have 27 people in attendance, which is exciting. And Melanie, just to check in, do we have both of our speakers ready to go? You can just give me a thumbs up.
They are both here and ready to go.
All right, and why don't we go ahead and get started? I know everyone is eager to learn more about our two local initiatives that support persons who are living with HIV or AIDS. So as Melanie mentioned, welcome to our Multidisciplinary Approaches to End Homelessness webinar. As you know, we've been hosting these each and every month with you in mind. And again, this space is really used as an opportunity to highlight local talent, AKA each and every single one of you. We are always looking for future topics and speakers. So if you are interested in learning about a particular program or you would like to highlight one of your own programs, please email us at coc@rivco.org. Again, we'd love to hear from you. Melanie ensures that both the recording and the PowerPoint and any additional handouts that are provided during these series are posted to our website. So if you really enjoy what you hear today and find that it will be informative for other people on your teams, feel free to direct them to our website. This idea really came about through conversations with other partners who were just really impressed with how much good work is happening in our local community. And so again, we wanted to create this space for everyone to have an opportunity to learn about the different programs and services we have available. We'll jump over and quickly review the agenda today, which I'm sure you all know. You hopped on because you saw a flyer and the topic and speakers today were of interest to you. So thank you. My name again is Tanya Torno. I'm the Deputy Director with our Housing and Workforce Solutions Department and specifically support our Continuum of Care team. On this call, we have several of our team members, and I think it's always important to give major shout outs because they have been instrumental in helping us plan for these events. You know Melanie Wilson, she is our key coordinator and has really in the last 14 months ensured that every single month we have a program here to deliver to you. So thank you, Melanie. I know there's a lot of work that goes on behind the scenes to coordinate all of this. Also on the line, we have our new manager, Emma Singh, who is here and will be facilitating next month's webinar. We also have Monique Guerra, who is our Youth Homeless Coordinator, Lindsay Sisti, who is our Emergency Solutions Grant Project Manager. I see Rashana Walker. She's also one of our project managers and is supporting both our encampment responses and homeless assistance program. And let's see, who else do we have? Salam Walker, who's with our HMIS team. So again, I just wanted to kind of point out members from our team who are here and always eager to support you. At 10:05, which is now, so I'm cutting over time, we'll be hearing from DAP Health and specifically CJ Toke, who is the Director of Community Health and Sexual Awareness at that organization. They are located in the city of Palm Springs and will be sharing or providing an overview of the different health and other services that they provide to people who are living with HIV and AIDS. We also welcome Kim Warren, who is the HOPWA coordinator with the Housing Authority of the County of Riverside, and will be joining us there shortly after. As a reminder, we always do our best to try to leave time at the end for questions. Sometimes time permits and sometimes it doesn't. So what we encourage you to do is to type in your questions to the chat box as the speakers are presenting so that they can quickly shift over to the chat box during their presentation or towards the end of their presentation to answer any questions that you have. Again, please take advantage of that resource. Again, our intent here is really to ensure that you walk away with a resource, a better understanding of a resource that you can help connect individuals to. So with that, I'll go ahead and once again, welcome CJ. Thank you for joining us. We're so excited to learn more about DAP, and I'll hand the mic over to you so you can shine. Thank you.
Thank you so much. Good morning, everybody, and thank you for having me talk about DAP Health today. I'm sure many of you are wondering what is DAP Health doing, especially through COVID, because we know that our homeless neighbors significantly have been impacted by this pandemic, along with Black and brown folks, trans folks. It goes across the spectrum as far as how this pandemic has disproportionately affected other populations, just like the HIV epidemic does. And so I'm CJ Toby, the Director of Community Health and Sexual Wellness at DAP Health. And to share with you a little bit personally about me and why the homeless crisis that's continuing to happen here locally and nationally is a personal passion of mine, is because I once was homeless. I had an AIDS diagnosis at the age of 24, and I ended up choosing homelessness and hopped on a plane with nothing, moving here to the Coachella Valley. I needed to get out of rural Ohio and just have something new. And so I did everything to survive. And so I'm the first one to admit, I know that because I'm a white cisgender male, that if any of those things were different, I may not have had the opportunity to be where I am today, which will be to talk about everything DAP Health as an organization is doing, and then a lot of the wonderful teams that I lead who are really doing that frontline work to make a difference in the community. Next slide, please. So here is a timeline of Desert AIDS Project, now DAP Health, of nearly 4 decades of service, and how this organization was founded through volunteers in response to the AIDS crisis. And then as you can look at this timeline, you can see the different milestones that some of you may be familiar with. However, a lot of people don't know that we offer services to non-HIV patients, which I will get into that more in depth soon. What we've learned, though, is we've taken a lot of lessons that we've learned through the AIDS crisis and are applying them today to understand that healthcare, HIV care, taking a pill and seeing a doctor, it's more than just doing those things. It's about all the social determinants of health and creating infrastructures and programs to help support people through their journey of life. And so that's why housing first is significantly important, addressing anything to do with substance use or any mental health challenges someone may be facing. And also food in their belly. No one's going to do anything or prioritize their healthcare if they don't have a full stomach. So that's what we've learned through nearly 4 decades of service, and how we're continuing to improve programs for wraparound vital services here at DAP to serve the broader community, regardless of HIV status. Next slide, please. So this goes into really a majority of what DAP Health services are. So healthcare, for example, we have HIV care. HIV care here is about 30% of our total patient base. 70% of our patients here are actually non-HIV. So they receive their primary care here, their gender-affirming care here, potentially their hepatitis C care here. So I wanted to state that because a lot of people think that, still today in 2021, that we're only an HIV clinic, and that's actually the case. That's actually not the case. We also have a dental clinic here as well. It's specific for folks who are either uninsured or have Medi-Cal. If you have private insurance, we don't accept that. We really have our dental clinic geared towards those folks who are either uninsured or underinsured to get into our dental clinic. And we currently have about, I believe, a 6-month wait to get in, but most dental clinics typically have a good 3 to 9 month wait. So we have dental services. And then behavioral health, we just opened our new behavioral health clinic last week. It's our Purple Clinic here on campus. And there's a list of all the different services that we provide, including psychiatric medication management, psychotherapy, We also have an integrated LCSW within our primary care clinics. So anytime that primary care clinician identifies that there may be substance use or mental health challenges facing their patient, they're able to bring in an LCSW right away as that bridge of service to our behavioral health department to really immediately respond to those social determinants of health right away for those patients. We also have a peer support substance use specialist as well, and then full case management for our HIV clients and also clinic case management for our non-HIV clients. And then we have an early intervention services program, also known as EIS. It's a team of 5. And so this program is really responsible for any new HIV cases, any hepatitis C cases, or any patients living with HIV that have fallen out of care. So if a case manager can't get a hold of a client for a month, or a patient's been no-showing, 2 or 3 different appointments, these patients are referred to this program, who will immediately go out to the homeless shelter or to a homeless organization, contact the emergency contact, go to the WASH, for example. It used to be Sunrise Park, the boxing center, wherever we need to go to try to locate individuals that have fallen out of care. That's what that EIS team does. Sexual wellness, so we have a sexual wellness clinic. I actually have a whole slide dedicated to that because that's really my area of expertise that I really want to share with you. And then in response to COVID, we opened a COVID-19 triage clinic where we provided testing, and then obviously now we're doing vaccines as well for staff, volunteers, patients in the community. We have a social services department, which I touched on a little bit with case management, but we also have a home health department specific for our older or high-need population living with HIV to bring services to their home, so they don't have to come here on campus. And so our home health nurse team is wonderful and at meeting the clients where they're at in their home. And then also part of our social services is we have a wellness program. It's filled with over 30 different social support groups. It also contains acupuncture, chiropractor. We have a nutritionist, Reiki, massage, you name it, anything to do with wellness, and on-site computer lab that patients can use as well. And then if you've not been to our campus either, we also have an on-site Walgreens and an on-site LabCorp and urban yoga as well that can be used by our patients or by staff as well. Next slide, please. So housing first. I know that's the biggest reason why we're here today, and to me it's one of the biggest challenges that we're facing that we need to continue to immediately respond to. And so for DAP Health, we currently have Vista Sunrise 1, which is located right behind our campus, and it's housing 80 clients. The 81st unit is for the property manager. And then we currently, with the Coachella Valley Housing Coalition, we just secured funding, I believe it was last week, and we'll be breaking ground around the 1st of November for a second housing structure that will be right off of Sunrise Way in between our admin building and our second building. And it's going to be known as Vista Sunrise 2, and that's going to actually be 61 units, and it's going to be specific to special needs housing. And then that's going to be about an 18-month project as well. And we'll have an on-site housing case manager there available at all times. Next slide, please. So then we also have housing programs here at DAP. One is Ryan White Housing Program, so this would be specific for folks who are living with HIV. And so it provides emergency rental assistance and then also motel vouchers up to 90 days with a housing place that's actually in place. And then Hopwa, I know there's a big presentation coming up, so I'm not going to go there, but thank you for the collaboration and the partnership and everything you do for the community. I'm not going to go into any of that because you're the expert. But then also for our non-HIV clients. So what we've been doing is we just provide referrals really to local agencies. So Catholic Charities, for example, Salvation Army, Jewish Family Services, and Lift to Rise for any housing assistance. I used to be a clinic case manager about 4 years ago. And I can tell you, as a clinic case manager, helping support patients who are facing housing challenges, it was significantly hard for non-HIV patients to really do anything related to housing as far as getting support. Next slide, please. All right, so sexual wellness. This is really my specialty, which is also known as the Orange Clinic. It was formerly known as the Doc. I'm not sure if many of you were familiar with that, but it's our on-site sexual wellness clinic. And so what we've identified through about 2.5 years of data is that 50% of new HIV cases were living at the 200% or below SPL. And so we knew cost is a significant barrier to accessing preventative testing, but also coming in to get any kind of treatment as well. We also have seen a rise in HIV and STIs, specifically gonorrhea and syphilis through the COVID pandemic as well. And so after much discussion in about May and June of this year, we decided when we opened the new sexual wellness clinic, the Orange Clinic here on campus, that we would eliminate all costs for services in this clinic for the next 6 months. So we're anticipating free services, which include PrEP and PEP services, HIV, any STI, gonorrhea, chlamydia, syphilis, and then hepatitis C testing and treatment is all free. And we're doing that now until the end of this year and potentially even longer. So we recommend, obviously, to make an appointment. We do accept walk-ins. I can tell you we saw about 124 walk-ins last month, which is a lot. We continue to see that increase. And then also, we've seen over 1,000 patients just the last 2 months in that sexual wellness clinic, and we've started over 80 new people on PrEP in the last 2 months. And for those of you who don't know what PrEP is, it's pre-exposure prophylaxis. It's the pill that people who are non-HIV can take to remain HIV negative. It's very similar to like the birth control pill. You take it daily, it's over 99% effective, and that person can remain HIV negative. So you can actually get those services now for free through this clinic. And then when you talk about medication, right? So we just talked about HIV prevention. Well, what about HIV treatments? And undetectable equals untransmittable, U equals U. So that means somebody with HIV taking medication as prescribed can reduce their viral load so low that it becomes undetectable, which has been proven that when someone with HIV achieves this undetectable status, they cannot transmit HIV to a non-HIV sex partner. And so Rapid Starts, this clinic houses our Rapid Start program. So let's say we have a patient who has been out of care for 5 years. They just moved here from Tennessee. They identify as a trans female. They have no insurance. They don't have a doctor here. A whole bunch of different other things that we could talk about. They walk into this clinic and they will immediately get onto this Orange Clinic schedule, and they will be assessed by our medical team and our linkage to care team, and they will leave with a 2-week supply of HIV medication and 2 follow-up appointments on site with their HIV care as well. So what this Rapid Start program has done is, yes, if we test someone on site for HIV, we'll get the medication that day, but also folks who are moving to this region or have already been living here, but for whatever reason has stopped care, they will come into this program, they will be seen by your team, they will get medication. And I know a lot of people here on this call are probably thinking, that's great, you get medication to someone, but what about all those other social determinants of health that's going on? And so, as you already know, the wraparound vital health services that we offer here, including the support through case management, EIS, a food program, we're now integrating an MSW intern into this Orange Clinic. So if that clinician sees that this patient has been out of care for 5 years and they have mental health challenges or substance use, they're able to call that MSW intern to come in and intervene and do an assessment and help support that patient with their ongoing HIV journey. Next slide, please. So the mobile clinic. Some of you may be familiar with the previous mobile van, which was orange, and it was Get Tested. It was Live, Love, Get Tested. And we had this van back in 2014 through the Get Tested Coachella Valley campaign, which I'm sure most of you are aware, but it was a big public health campaign to really reduce stigma around HIV and really bring partners and community support to ensure that everybody knows their HIV test. And so we did HIV testing then out of that orange mobile van from 2014 to 2017. And as that campaign ended, we shifted more towards not just the broader community, but towards those communities who are most impacted with HIV. And then now, in response to COVID, we felt the need that, hey, we need to do more. We need to add services to this mobile clinic. We need to get community feedback about what this mobile clinic should look like. So we went through and we surveyed patients who were getting services out of the mobile testing van that was orange. What would you like us to see? What colors do you want? Do you want to see people on it? Do you want to see images? What would more represent you and be more universal and accepting to bringing services to where you are? And so a month ago, we rewrapped the mobile unit. It's now part of our federally qualified health center scope of work as an additional site. And we're currently getting licensing through the state health department as well. The services that we're currently now providing, which is more than what we were a year or two ago, which is HIV, hepatitis C, and STI testing. We will be integrating treatment with a registered RN. And then we've also done COVID vaccines out of this mobile clinic as well. I know we partnered with Find Food and then also with some of the homeless organizations as well, and the James O'Jesse Unity Center too. Part of the mobile outreach that we identified and deployed through the pandemic. So if we look at the health center and what the pandemic has made many healthcare organizations do, which was to go to virtual care. And so what we identified when we launched virtual care was we noticed our no-show rate did decrease. However, we identified that there was a lot of patients who were still no-showing, and they all reported not having a phone. So they couldn't say they needed transportation to get to their appointment. They obviously couldn't attend a virtual care appointment or communicate that, hey, I need to reschedule and I need assistance. We also identified that a majority of these folks without a phone were members of our trans and non-binary patient population as well. So we immediately said, well, we need to get track phones to patients. We need to come up with a program. We need to get track phones to patients' hands who need this to access community resources, but then also to stay in contact with their care team and attend medical appointments. So the track phone program now is anybody that we identify in the community for that needs STD treatment, that needs to get services here at DAP, who are living with HIV, whether newly diagnosed or out of care. We distribute track phones here on site through our EIS team and also through the mobile clinic through our testers. And what we do is we give a track phone 30 days of airtime. We do talk to the patient saying, here's this phone. The expectation is you access community resources, you stay in contact with me, and then also anybody on the clinical side to make sure that you get to and from medical appointments. And then during those 30 days, we work with that patient to then get a phone through Assurance Wireless through the government. And then once that phone is shipped here at DAP, we do an exchange. We say, here's your ongoing phone. Please give us the track phone back. So that way it empowers them to obtain their own phone. We have encountered one hurdle with this, which is many folks have already gone through their free phone that's issued by the government. And then we looked at their policy and you can't get another one for 12 months. So what we're currently doing then is we've been able to secure grant funding to be able to then additionally add 30 more days then onto that track phone or whatever we need to ensure that that patient stays in contact with our medical team. And as long as they are compliant to treatment and they're using that phone like it should be gone over when we meet with them with expectations, we continue to help support them to make sure that they have that option for a phone to access community. And then the vision for the future of this mobile clinic, pretty much everything that I talked about in the sexual wellness clinic about rapid start and PrEP, we're wanting to replicate into our mobile clinic with an RN. So if we have a patient coming into this mobile clinic who is either testing positive for HIV, out of care for HIV, or would want PrEP, for example, they would leave with medication. They would leave with a 2-week starter pack and then an on-site appointment either at our on-site clinic or virtually through this mobile clinic at its next venue. So that's kind of what the vision is for the mobile clinic, is to continue to expand services and increase a medical presence in that mobile clinic. And I'm sure some of you are probably wondering about, well, how do you determine where this mobile clinic will go? And so we have, for any of you data nerds out there, which is me, I could look at data all day long, but we have systems here that are linked with our EHR system known as Epic, Ocean Epic, and then also a system with Power BI that does heat mapping. So it will identify literally anybody in the country that is actually tested positive here for STIs, HIV, or hepatitis C, along with any socioeconomic detailing that I may need to be able to then strategically look at where are the spots in the Coachella Valley that we really need to look at bringing outreach services to. Next slide, please. Next slide, please. Okay, sorry, you can go back one more. So HIV continuum of care. So someone's diagnosed with HIV, linked to care, received HIV medical care, then retained in care, and then achieved and maintained viral suppression. Viral suppression is the undetectable equals untransmittable, where someone living with HIV cannot transmit HIV to an HIV negative sex partner. So these are the 5 blocks, but we all know there's so much more that happens in between these 5 pillars for an HIV care continuum. And so if you look back at the presentation and you think about all DAP is doing as far as their services, and then also their amazing partnerships across the community, which are all of you, about how do we fill in those missing gaps to help support that unique patient that's trying to come here and take that HIV medication, that's trying to come here and take that PrEP medication so they don't get HIV. And so to share a story with you to end this, and obviously we're doing a Q&A at the end of this presentation, and I'll put my email in for any follow-up questions. Just imagine a patient who we recently had who tested positive for HIV at one of our homeless organizations here in Palm Springs. They were living, all their belongings were in a shopping cart. And so our outreach team is instructed to get that patient to DAP, to the main campus, to be assessed, to get them food, to show them the campus, get them to see a doctor, help support them with whatever referrals that they may need, either internally or externally. And that client said, I'm not leaving. I'm not getting anywhere. I'm not leaving what's in my cart. This is everything I have. And so what our outreach team did was they already had a relationship with this patient who they've tested before. So they were able to get the patient to agree that we'd get the patient a lift to campus, and we would go ahead and take their shopping cart that had all their belongings and put it inside of the mobile clinic, which would then meet that patient here on site. And so that was a huge step of trust with that patient. And so we made sure that the mobile clinic followed the Lyft driver here to campus, and then we were able to take the shopping cart with the person's belongings and give it to them as they came through the organization to their doctor appointments. Immediately as that patient then was being assessed in the sexual wellness clinic that I just talked about, we obviously identified as a clinical team that there were a lot of different social terms of health going on with this individual that were crucial to them, not just taking the pill today and getting that 2-week starter pack, but also maintaining HIV care. And so that was when we ended up having our MSW intern then come over and assess that patient to be able to then go over those substance use challenges or anything to do with mental health that they may be able to support them. That patient here on site is also met by the EIS team that I mentioned, who's going to go through and do a complete assessment in acuity and provide any kind of referrals, whether it's a conversation with a housing case manager, whether it's a career building program, whether it's our peer support for substance use, or maybe it's just a simple conversation about how are you doing right now? What's going on? You just found out this life-changing news. How are you doing? What can we do to help? Do you just need a hug right now? Do you want a granola bar? It just listen to that patient. And a lot of times that's what is most needed during a time of a new HIV diagnosis. So I wanted to kind of share you that patient story to let you know of different things that we're currently doing here at DAP. And to wrap this up real quick, I know several months ago, there were, I believe it was over 50, if not 100 people that were released from different programs, and I won't get into detail, but got dropped off really in Palm Springs with no shelter, and nobody really knew what to do. So we had 2 weeks of planning for outreach, different locations, and we internally decided right away, you know what, we're canceling everything for 2 weeks, and we are sending 3 different groups of outreach teams with backpacks and Gatorades and granola bars and track phones, and we're going to go out there, we're just going to have conversations with people and see if we can help direct them to where the nearest food location will be or where they need to go for housing during the day, anything that they may need. Because could you imagine if any one of us was picked up without anything, phones, you name it, and dropped in, say, another country or another city that we've never been and not familiar with, on top of any mental health diagnoses or substitutes that may have been happening as well. So we dropped everything and deployed an outreach team to help try to build some sort of a relationship with these new residents of Palm Springs. Next slide, please. Okay, and I know we're doing questions at the end, so I will defer it back to you. Thank you.
Thank you, CJ. What a great presentation. I thought I knew everything there was to know about DAP, but obviously I didn't, because I am walking away with a page full of notes. I am reviewing the chat box. I don't see any questions, just a bunch of kudos for a well job, and congratulations to you and your team for securing additional funding for that housing project, that second phase housing project that will be going behind your main building. I'll give it another second just in case there is someone in attendance that would like to ask a question. If so, feel free to unmute yourself. We'd love to hear from you. All right. Well, CJ, again, that just means you really did provide a well overview of all your services. Thank you so much for joining us and taking our invitation. We appreciate the great work that you're doing and hope that we can see more of you at our Continuum of Care meetings in future months. Thank you so much.
Thank you.
And with that, I'm going to go ahead and introduce and welcome Kim Warren, who is the HOPWA coordinator at the Housing Authority. Welcome, Kim. We are ready to hear from you.
Okay, thank you. Thank you for giving me the opportunity to be here. Good morning, everyone. It's good to see some familiar faces and names on the call. So I am Kim Warren, as Tanya said, and I'm the HOPWA coordinator here at the Housing Authority in the Special Programs Unit. Next slide, please. So my agenda today, some things I'm just going to cover. I'm going to give a short, brief personal introduction about myself, talk about the HOPWA program, what it is, the reason for the program, how people can apply for the program, the eligibility requirement, the services that the HOPWA program provides, how those services are administered, and of course, questions if there are any. Next slide, please. So my background is in therapy. I'm an AFT registered with the Behavioral Board of Sciences, and I have been a case manager in the SSVF program, permanent supportive housing, and also the housing coordinator for Safe Haven for a U.S. vets before I came to the Housing Authority. And I've been working with the homeless population for about 7 years now. When I was a therapist in the community clinic, that was a population of people that I did serve as well. So it's been working with the homeless population has been rewarding for me and fulfilling, and I have also learned quite a bit. On to the next slide, please. So what is the HOPWA program? I know before I came to the Housing Authority, I hadn't heard of the HOPWA program. So I have learned so much, and I'm going to share all of that with you. Next slide, please. So HOPWA stands for Housing Opportunities for Persons with AIDS. The program was created in 1992 by the Office of HIV and AIDS, better known as OHH. I've learned here at the Housing Authority, we love acronyms, so we have a plethora of them. So, and the HOPWA program is the only federal program dedicated to housing those specifically that's living with HIV and AIDS and attending to their needs. So the U.S. Department of Housing and Urban Development, which is HUD, makes grants to local community, states, and nonprofit organizations for projects that benefit low-income persons living with HIV and AIDS and their families. So the Housing Authority is one of those entities that does receive funds to run the program. Now, since the HOPWA program, the reason for the program, because we know early in the HIV, the HOPWA program was first created in 1992, and before changes that occurred in the HIV epidemic in our country. So we know in the early 1990s, there wasn't advanced medical care. And as CJ stated from DAP, they have advanced medical care now, and they have things out there for those that's living with AIDS to where HIV is barely detected. So before all these therapies came about, it was almost everyone infected with HIV progressed rapidly to an AIDS diagnosis. So those that were living with AIDS, their life were cut short, and the end of life often meant debilitating illnesses as well as loss of income, loss of support systems due to stigma, and loss of housing as well. So the HAPA program's main purpose at that time was to be a safety net for those and provide decent housing for people with AIDS to live out the end of their lives with comfort and dignity. Because not only is it, I can't imagine having to deal with the health challenge and then having to deal with being homeless as well. So I was happy to know that there was a program such as the HAPA program to provide those kind of services to that population of people. And as we know, the epidemic today is quite different. So HIV is not an assumed death sentence like it was in the early 1990s. So with quality of HIV medical care and therapies, a person with HIV can live long, healthy life without ever progressing to an AIDS diagnosis. People living with HIV often face temporary illnesses and financial crises related to their health because some of them aren't able to hold down jobs so that they can sustain their housing or sustain their standard of living. So with adequate medical care and supports like housing and being able to address those temporary barriers to health and well-being can be overcome through the HAPA program. So I think it's a great, wonderful program. I've learned a lot, and I'm happy to be able to oversee it. Next slide, please. So next, how to apply for the HAPA program. So I've put here is our housing options program application, where a client who's interested in the program can fill the application out and they can forward it to the housing authority. What we do here, we have a waiting list, and everyone goes on the waiting list, and we are currently working on systems now to move the waiting list so we can graduate people onto the program. But we do have a waiting list for the HAPA program, and this is the application. So if organizations or if people want to apply, then they would fill the application out and then just send it in to the housing authority. Next slide, please. Okay, so the eligibility requirements for the HAPA program. So first, of course, you have to be HIV positive and show proof of diagnosis. But for low-income persons at or below the 80% of the area median income that are medically diagnosed with HIV and AIDS, and their families are eligible to receive HAPA-funded assistance as well. So if you have the head of household who may be HIV positive, then whoever's in his family will also be able to reap some of the benefits of the HAPA program. I put these charts here just to show the difference. The first one where it says low income, 80% medium, this would be the HAPA program criteria. And then the 30% and the 50 is Section 8. And I wanted to put it up there to show everyone how the HAPA program has a little more versatility as far as income is concerned. So if on the 80% medium chart, if you have a household of one, the income limit is $42,200. So someone who's HIV positive and wanting to get on the program can make up to $42,200 annually and still be eligible for the program. Whereas Section 8, even 30% and 50%, theirs is a little lower. For example, the 50% area median for a one-person household is $26,400. So for Section 8, a person can't make any more than that. So if you have someone who's HIV positive and might make a little bit more, like $35,000, they wouldn't be eligible for Section 8, but they would still be eligible for the HAPA program. So the HAPA program's income eligibility limit is a little higher, and that's another reason why the HAPA program is so advantageous, because the income limit is higher. Next slide, please. There we go. So some of the services provided is tenant-based rental assistance. In-house, we call it TBRA. And what TBRA does is provide housing subsidy to HOPWA eligible households in a unit of their choice, and in providing safe and affordable occupancy. So tenant-based TBRA is like our voucher programs. And with the voucher programs, tenants they have their choice to live where they want to live. The other service that's also provided is StreamU, short-term rent, mortgage, and utility assistance. And this program provides short-term stabilization intervention to HOPWA households that are not receiving ongoing rental assistance and are experiencing financial crisis. And this reduces the risk of homelessness. So StreamU is more like a preventative income stream source for the HOPWA program. And TBRA, the tenant-based rental assistance, is an ongoing like a voucher program, like Section 8. And then, of course, the HOPWA program, we have vouchers as well. Permanent housing placement is also a service that's provided in the HOPWA program. It establishes permanent residency where continued occupancy is expected to continue. It's used to assist in locating and moving persons into permanent housing. And one thing I wanted to point out with TBRA and StreamU, these two funding sources can't be used in conjunction together. So if you have someone who's on a voucher program and they pay 30% of their income is what they pay for rent if their situation is as such, they couldn't go ahead and then apply for StreamU because they are already receiving a housing subsidy. So StreamU wouldn't be able to be used in conjunction with TBRA. So I just kind of wanted to make that distinction. Next slide, please. And other services that are provided is permanent supportive housing, which is project-based facilities. Housing Authority, we have some project-based facilities that we own, and some of our partners that we collaborate with also have some project-based facilities that house HOPWA clients. There's also short-term emergency services, which is your emergency hotel and motel vouchers that are available for the HOPWA population, and supportive services such as case management, transportation assistance, and nutrition assistance. Something I want to say also about TBRA is portable. So since it is a voucher program, if tenants want to move, their voucher moves with them. It's not like project-based, where project-based is just for that specific facility. So we have both of those services, and it's versatile to be versatile for those for different situations. Everybody's housing situation is not the same. So when you do your assessment of what the client needs, it's important to kind of know the differences and what you can use in conjunction with one another and what you can't. Next slide, please. So now the administration of services, the eligible funding uses. So funding uses that are eligible under the HOPWA program that's outlined by HUD is HOPWA funds may be used for a wide range of housing, social service, program planning, and development costs, such as acquisition, rehabilitation, new construction of housing units, costs for facility operations, rental assistance, short-term payments to prevent homelessness, as we discussed, and social services. So HOPWA funds may be used for services including but not limited to assessment and case management, substance abuse treatment, mental health treatment, nutritional services, job training and placement assistance, and assistance with daily living. So the HOPWA program it's really advantageous for those living with HIV and AIDS because it's like a wraparound support for them, which is really good because they don't they don't feel alone. And especially with housing, it's important that they can be comfortable since they're already dealing with a health challenge. But being able to be permanently and securely housed is something that's real important. And for them in staying healthy and dealing with their health challenge that they currently deal with. Next slide, please. And of course, the Housing Authority, we offer the tenant-based rental assistance program, which is scattered sites, and permanent supportive housing, which is our facility-based. So I didn't want to leave Housing Authority out. I know when I was initially putting the PowerPoint together, it's like, oh, I got to put Housing Authority in there. So we do offer TBRA and permanent supportive housing, which is facility-based, and we do have units that we own that are facility-based. Next slide, please. Okay, so these services are also, in addition to Housing Authority providing services, we have subcontractors that we deal with. And number one is Desert AIDS Project. So I was happy to see that CJ from Desert AIDS was on the panel just to talk about their organization in detail, because I also learned some things as well. So it's great. So our subcontractors that we use, Desert AIDS Project, and they offer permanent supportive housing, project-based. They offer stream view assistance, supportive services, permanent housing placement. And then we also partner with Foothill AIDS Project, who also has stream view assistance, short-term emergency assistance provide for clients, permanent housing placement, and supportive services. Then there's True Evolution, who offers short-term emergency assistance and supportive services. And then there's Catholic Charities, and they offer stream view assistance, supportive services, and permanent housing placement. So these are the organizations that we partner with and collaborate with, and it's really great. I've enjoyed working with all of them. I've learned so much. And I'm just glad that we are able to offer services to our clients that the Housing Authority ourselves don't, but we've partnered with other organizations that can offer services that we may not have here. So it's just like a whole wraparound program. So I really like it, and I know the clients and the tenants really appreciate it as well. Next slide, please. Okay. Then that's it for me. And I guess I will go ahead and turn it back over to Tanya.
Thank you so much, Kim. Wonderful presentation. Loved hearing about all the new updates to HOPWA. It's definitely a program like DAP that I carry close to my heart. I started off with the Housing Authority and was always very much impressed with the different partnerships that the Housing Authority has established to really ensure reach and access to residents and their families who are impacted by HIV and AIDS. So great job. I'm going through the chat box now, not seeing any direct questions, but as has been our practice, I'll go ahead and take a moment to see if any of our participants have any questions. Feel free to unmute yourself. This is your time.
We have a question in the chat box. Can we get contact for the HOPWA funding sources for new construction of permanent housing?
Sure. Yes, I can get that out. What I'll do is I'll put my email in the chat box, and that way anyone that wants to contact me, even after the webinar, they can contact me. So I'll go ahead and do that now.
Thank you, Kim.
Great question. Thank you for asking that, Jenny. It's good to have you on here. As with CJ's presentation, Kim, you're getting lots of great feedback from participants. Great job, excellent job. And of course, Melanie noting that both presentations were very, very informative. So with that, doesn't look like we have any other questions. We will go ahead and wrap up our program for today. Many thanks to both of our speakers and the work that your agencies are doing to carry out these projects every day. Jenny, we will send out an email following this presentation to all attendees that will include both the video recording link in addition to the direct link to our website where all of the documents, supporting documents, the PowerPoint, and others are located. So feel free to reach out to us directly at coc@rivco.org if you don't receive this email. But again, Melanie's pretty good about sending those out as soon as these wrap up. So we appreciate knowing that you guys are interested and you want those follow-up materials. So please don't ever hesitate to reach out. These are definitely intended for that very purpose. So with that, I'll go ahead and dismiss us a few minutes early. My hope is that you enjoy the rest of your afternoon, and we will see you during our next month webinar. Melanie, I don't know if you want to give a plug and talk about the speakers.
I will, Tanya. On November, our November webinar will be on Runaway Youth Awareness Month. So you'll see a flyer going out for that. To honor Runaway Youth Awareness Month, we will be talking about runaway youth programs.
Great. Thank you, Melanie, and thank you, everyone. We'll see you soon. Blessings to all. Take care.
Bye, everyone. Have a good day.
Bye.